My name is Dr. Cameron Stanley. I'm one of the veterinarians here at Grady Veterinary Hospital. I primarily just work overnights on emergency. This is my little girl Chica here, and I brought her along today just because she kind of fits along with what I wanted to discuss a little bit about today with you all. What I wanted to talk about a little bit was GI upset, especially with any dog, but especially these little toy breed dogs. They're very prone to upset, GI tracts, vomiting, diarrhea, especially when it's important not to give them table scraps or switch their food suddenly to something they haven't been used to or been being fed on a regular basis. And what I mean typically is that it's really important not to go drive through, say, McDonald's or Wendy's and Burger King. I'm just going to give them, hey, a piece of my hamburger or something. A lot of times this can really seems small, but it can really upset their GI tract. They can start having some acute vomiting, diarrhea, and if it gets severe enough, they can actually get pancreatitis, which that is just like in people. That's something that can turn very quickly and can be deadly. Now, what we do specifically with that, I do see a lot of that here overnight. Acute vomiting and diarrhea, and it can be related to other causes, but one thing that I do want to discuss is, if your pet at home is having a lot of vomiting and diarrhea throughout the day, it is important to get them seen, not only because, just like with us, they can get dehydrated really quickly, and also, too, enough inflammation of the GI tract, they can, start to get a lot of that inflammation of the GI. They can start to get bacteria in their bloodstream. They can get sick really quickly. So it's important, one, to bring them in. We like to check the blood work. Let's check some things out, see what's going on. Two, a lot of times these guys will need some fluids, some either IV fluids, or they at least need some fluids under the skin to keep them hydrated. Another thing we like to do, get them some anti-nausea medication so they don't, so that they feel a little better. Two, the other thing, antibiotics. A lot of times with their GI upset being so out of whack, as I call it, it's important to get them on something to kind of help keep the balance in their flora of the GI tract. So, two things. One, please, don't feed them, drive-through fast foods, any kind of treat, table scraps that we might have. If you're going to change their food, it's very important. One, I like a high-quality food. I try to stay away from kind of lower grocery store brands. But if you do change their food, just do it gradually over about a week, 7 to 10 day period. And two, it might not be if they do have acute onset of vomiting, diarrhea. It is important to get them seen relatively quickly because it can get pretty bad pretty quickly. And we like to keep these guys, healthy and running around. So, also, if any time you do have any questions, please feel free to give us a call here at Grady Vet Hospital. Of course, our number is 513-931-8675. Thank you. And Chica says thanks for your attention.